I think I'm pregnant.
Yile.
My name is Eva Kiwango and I'm the UNAIDS Country Director in South Africa.
I am Steve Letsike, Deputy Minister in the Presidency responsible for women, youth and persons with disability.
Molweni Mzansi Afrika, igama lam Asanda Luwaca, ndingusihlalo jikelele weagenda lophuhliso lolutsha loMzantsi Afrika, the National Youth Development Agency.
Good day, my name is Ndamase and I am the reigning Miss Teenager South Africa 2025.
I'm Des Jason from the National Department of Social Development.
My name is Nontando Mkhencele. I'm from UNAIDS and I stand in support of our girls.
Because teenage pregnancy is not an issue just for the health sector, but actually requires a whole of society approach. So we look forward as WHO to being a key partner in this dialogue, in this discussion, in this roadmap that has been outlined to address teenage pregnancies. It is preventable and we can all play a great role in this. Thank you so much.
This morning we were in attendance for an initiative that is championed by our Minister in the Presidency responsible for women, youth and persons with disabilities, Deputy Minister Mmapaseka Steve Letsike, on a thoughtful and really progressive engagements around the emergency and the crisis of teenage pregnancy, as well as discussing the various interventions that various partners, institutions, civil-based societies can collectively come together to resolve the plight of teenage pregnancy.
Today we gathered here with various stakeholders, various departments, development partners, traditional leaders, Chapter 9 institutions, all of a society to respond to this crisis of child and teenage pregnancy. One thing we are very much clear on, children must remain children and their future must be protected. No child must be forced into motherhood, and this is why we are gathering here as government to saying the policies and the laws we've put for ourselves must be implemented effectively. Secondly, the programs that have been designed to respond to the social, economic and structural issues that young people experience must actually address these needs. One that speaks to addressing poverty, addressing gender-based violence, including statutory rape. Children below the age of 16, when adults have sex with them, it is rape and it must be held accountable. Those perpetrators must be held accountable. But we are also saying that those children who have been exposed to vulnerability and now they are young mothers must be supported. They must go back to school. They must be having access to psychosocial support and economic support to actually address the issue of poverty. So ultimately we are saying we are waging a war on child and teenage pregnancy, and part of it is making sure that everyone is on board and government will lead this response as we have been directed by His Excellency President Ramaphosa.
Today we spoke about the pandemic that is facing young people who are falling pregnant, teenagers, those challenges that we are facing with. And also the biggest problem is that there's no empowerment education-wise, accessing information to what to do. Because in my experience, I see that most people in the deaf community, like myself, I don't have a space where if something was to happen to me sexually, I can go and report to. Do I tell my parents? Do I go to the police? Where do I find help? And one of the things that we spoke about is a struggle to accessing information and speaking in terms of how do we overcome those things. Is that help is needed, aid is needed, because also if you're falling pregnant at a young age, is that a mistake or you're being sexually abused? So many deaf young girls don't feel free. So it's important for government to have resources to ensure that information is accessible in South African Sign Language. So we have to empower from deaf school, do roadshows, and ensure that we empower these young girls. Also, furthermore, what was discussed is that when deaf people go to these spaces, it's not accessible, it's not accessible. They don't know how to protect themselves, be it hospitals or clinic. There's no way of accessing information. That's the serious challenge that you are facing. When you go to the police, there isn't an interpreter. So it would be great if there's a system that is created for one to access being able to report at a police station, get those services. So let's not leave anybody behind. Access to information includes South African Sign Language users. I thank you.
We are here today to address the topic on teenage pregnancy. Inside, we had a panel discussion where one lady had mentioned how she feels as though we need to go back to the traditional customs that they grew up in, whereas you check your virginities of the children basically yearly until they leave home. And I have to strongly disagree with that, because earlier the DM made a statement or a fact where he said that the whole point is to get the youth comfortable with speaking up about such issues. So I believe that if you're going to keep checking to see if there's still versions and to see what's going on, I don't believe that will create that safe space for your child to come to you and say, Mom, this is what's going on, this is what happened. I feel like if you are invading their privacy, it closes them off even more. So if it does come to a point where they've been sexually assaulted or raped, they're not going to feel comfortable enough to come to you because you had invaded their privacy initially. As the Queen, my stance is that I agree that teenage pregnancy has been accumulating and growing over the years, and it's getting worse. And the fact that it's even coming to kids who are 10 years old is just outrageous. I think that we need to continue to educate the youth. I think that the lack of information, the lack of education is what's causing these issues to subside and to increase. We need to educate our youth. We need to create safe spaces and open environments where they can speak and discuss all these things openly to prevent them from growing further and further.
And we came to the breakfast this morning to present on the evaluation study we conducted to understand what are the challenges around the issues on teenage pregnancy in South Africa. Out of the findings from the study, we also realized that we need to work together collectively as government in terms of the planning and also setting up inter-ministerial task teams, and also see that we have better planning and also implementation of our policies and programs to address adolescent pregnancies in the country.
Just want to say that the dreams of our girls are valid, and teenage pregnancy and child pregnancy steals those dreams away. And so we are here today to say it's everybody's role to play in terms of teenage pregnancy, the private sector, the public sector, all government departments, civil society. We all need to stand together. And more importantly, it starts in the home. I think the parents have a big role to play. Let's be there for our children. Let's be open. Let's communicate with them. Let's be reachable. Let's understand the issues that they are going through. Let's love them and support them. And together we can win this fight against teenage pregnancy. Thank you.
Today, I was part of this discussion, and my role was really to emphasize the importance of action and reiterate the cost of inaction. If we do not address teenage pregnancy, if we do not address gender-based violence, and if we do not end new infections it will cost the country a lot economically. So that was my role here, to emphasize the cost of inaction. We know what to do, we have the solutions, we need the political commitment, and we need, as the Deputy Minister said, to go out there and just get to work.
As SANAC, we are committed to ensuring that adolescent health, particularly sexual health and reproductive health rights, remain central in the implementation of the NSP. This crisis is not just about health, it's about human rights. It's about inequality, violence, and the failure to create safe spaces for our adolescent and girl children. It reflects deep-rooted social and structural issues that require urgent and united action. We need to stop normalizing what is not normal, and let us join hands to uplift, protect, and stand beside our children, because their future is our shared responsibility. Let's allow our children to be children in a safe and supportive environment, and SANAC stands ready to lead and to coordinate this response together with yourself, Deputy Minister. Thank you so much.
I have to start by saying that South Africa has achieved a significant reduction of teenage pregnancies since 2014. There were setbacks during COVID time, and it bounced back and plateaued. So what we need to do and prioritize is to accelerate the progress made in the past so that we can further and quickly reduce teenage pregnancies in South Africa. And second is to do with the message that is a long battle and a long fight, which requires a medium to longer term thinking, at the same time start addressing structural barriers that affects teenage pregnancies. But at the same time, there are quick wins because we know the hotspot districts, communities where perpetrates teenage pregnancies. Let's focus on these geographic locations.
We know that teenage pregnancy in South Africa is quite alarming, particularly taking into account that South Africa is one of the countries globally with the highest rates of teenage pregnancy, reportedly with over 100,000 girls aged between the age of 10 and 19 years giving birth annually. The provinces that are mostly affected include provinces such as Eastern Cape, KwaZulu-Natal, and Limpopo. This engagement therefore recognizes that teenage pregnancy is a crucial and significant issue which affects our youth psychologically, socially, economically, as well as health-wise. Therefore, as government, we acknowledge that our efforts to accelerate response to the crisis, to accelerate our response to the crisis of teenage pregnancy cannot be single-handedly attended to by government. We need to work closely with civil society organizations. We need to work with the private sector, faith-based organizations, community-based organizations, institutions of higher learning, community learners, community leaders, development partners, as well as young people.
The cultural taboos around discussing sex means many teens are uninformed about contraception and protected sex. In some areas, clinics are not youth-friendly. We know youth zones have been set up by the Department of Health together with civil society organizations. Many incredible work done by organizations that set up the youth-friendly zones, addressing the adolescent girls that must access proper and affirmative health services, where girls will not feel judged or unwelcomed, so that they avoid seeking contraceptives. Those youth-friendly zones must be increased everywhere, in the rural, in the townships, in the urban areas, where young girls can access contraceptives and programs that respond to their needs. Additionally, many girls are in relationships lightly with older boyfriends. and becoming pregnant due to a combination of ignorance, pressure, and insufficient guidance. We also saw this with younger girls who are in tertiary around transactional sex, and we never must pay a lip service, we must address the transactional sex. The statistics that were released, even by many partners, revealed that there's high transactional sex taking place. A man with money, whether they are buying bread, airtime, or cold drink, or whatever that people drink in their time of leisure, but it's cocktails. It should not result to a sexual exchange.
Especially for the girls who are at the adolescent age, there is a clear trend on exploitation. And I also would like to quote the recent South African Police Service statistics, the crime statistics. We have been seeing consistently 40% of all the sexual crimes committed in this country are against children, and predominantly over 95% against girls. And I think this is an important aspect to highlight as we move forward on this issue as well. It definitely has a strong linkage to address with the correlation with high prevalence of HIV/AIDS among adolescent girls. And we are already seeing that we need to tackle this issue together, not as a separate. We would like to appreciate the leadership of the Department of Women, Youth and Persons of Disability in convening us all relevant parties together, as we need to tackle this issue holistically. And then we have seen the Department of Basic Education contributing in comprehensive sexual education, Department of Health contributing in the adolescent-friendly sexual reproductive health services, as well as the police services and justice services that need to be condemning some of these violence against children, especially against girls.
These improvements underscore the fact that adolescent pregnancies are preventable. Let me emphasize that adolescent pregnancy is preventable when multi-sectoral efforts come together. So, Honorable Deputy Minister, I really want to take this opportunity to thank you for bringing different stakeholders together to address something that is preventable as well. Comprehensive sexual and reproductive health education has played a key role in driving these advances alongside supportive policies and programs. But progress is uneven, and we must sustain efforts to ensure that the most vulnerable groups of adolescent girls are not left behind. WHO has remained at the forefront of this effort. For instance, through the publication of the WHO recommendations on adolescent sexual and reproductive health and rights of 2018. And just recently, 2 weeks ago, we disseminated the updated WHO guidelines on preventing early pregnancy and poor reproductive outcomes among adolescents in low and middle income countries.
Former Deputy President Mabuza also spoke about teenage pregnancy, noting we cannot even begin to characterize this as teenage pregnancy, but an act of crime that needs to be prosecuted. It was very clear that we have a teenage pregnancy problem. And I know there are different schools of thought of how we should call it, whether it's teenage pregnancy, whether it's unintended pregnancy, etc. But we know that teenage pregnancy is high. It's leading to school dropouts. It's perpetuating HIV transmission, especially among young adolescent girls and young women, and it is perpetuated by GBV.
So this is not just a professional matter. It is deeply personal, because the girls we speak about today are our sisters, our classmates, our cousins, our peers and children. Some of them perhaps are even versions of who we once were. We gather here not in abstract concern, but in a direct response to a crisis that has already disrupted the futures of far too many young girls in our country. The statistics are not just alarming, they are harrowing. Recent reports reveal that the National Department of Health confirmed 122,000 girls aged 10 to 19 years gave birth between April 2023 and March 2024. So that's nearly 335 teenage births per day. This was not merely a public health crisis, it is a national emergency rooted in deep socio-economic fault lines and systemic failures.
You are going to hear horror stories, and we should review what we are saying about South Africans, about children's rights, about human rights, about constitutional rights. Because teenage pregnancy will never end if these things are not part and parcel of us discussing teenage pregnancy. So we must take everything head on. Even the policies we have, are they still relevant today? When were these policies done? Are they relevant to what we are talking about today? To fight teenage pregnancy. Thank you very much.